Hey everyone, and welcome to This Explainer. I'm a public health researcher, and I want to kick things off today by throwing a pretty massive, absolutely critical question your way, especially since you are the policymakers shaping our future. How on earth do we deliver tertiary-level diagnostic care to a remote village of 2,000 people, especially when there's literally no hospital in sight? It's a puzzle that has stumped global health for decades. But today? Well, today we're going to see how localized, boots-on-the-ground technology is actually solving it. Okay, let's dive right in. We've got a tight, evidence-based agenda for This Explainer. We'll be hitting bridging the healthcare gap, AI in frontline diagnostics, inclusive genomics and oncology, frameworks for responsible AI, and finally, building the tech workforce. Section 1, bridging the healthcare gap. Let's get a baseline of what we're actually dealing with out there. Look, our current healthcare landscape is completely defined by spatial inequality. Think about it. All the high-tech imaging gear, the certified radiologist, they're heavily clustered in urban centers, places like the Kolebu Teaching Hospital in Accra. But what if you're a patient in a rural or peri-urban district? You are facing severe geographical barriers. We're talking pregnant women walking miles on foot just to get basic care. And these spatial disparities, combined with chronic staff shortages, directly drive up maternal mortality and lead to way too many late-stage disease diagnoses across resource-constrained environments in sub-Saharan Africa. Moving to Section 2, AI and frontline diagnostics. This is where we look at actual field-tested solutions. Traditionally, rural midwives have had to rely on a fetoscope, and honestly, it's pretty limited. It basically just monitors the fetal heart rate. But compare that to Baby Checker AI. This thing is a total game changer. It's a portable, smartphone-enabled ultrasound. A midwife can just do a basic blind sweep across the abdomen with a handheld device, and deep learning models instantly kick in. Completely offline, it estimates gestational age, checks placenta positioning, and flags severe complications. It literally brings the scan to the patient, cutting out those brutal long-distance travels. To really understand the human impact, listen to Mary Otofa. She's a frontline midwife working out in the rural Mount Kwazi zone, which serves about 2,000 people. She said before, we used the fetoscope, which could not detect any abnormality, but now with Baby Checker, we can see so much more. Recently, during a routine home visit, she used this exact tool and spotted a low placenta in 2 different pregnant women. Without this AI, those mothers would have delivered at home completely unaware of the danger. But because of this automated tool, Mary immediately referred them for life-saving C-sections. I mean, that right there, that is exactly how you reduce rural maternal mortality. And if you're wondering about the clinical data, the evidence is absolutely rock solid. Local AI labs like Mino Health have developed deep learning models that are going head-to-head with board-certified radiologists. When screening for thoracic conditions like pulmonary tuberculosis, the AI system hit an overall accuracy of 91%. That actually outperformed the human radiologist's 86%. It even scored higher in both sensitivity and specificity. We aren't replacing doctors. We're augmenting human capability with highly accurate automated clinical image interpretation. Let's jump to Section 3, Inclusive Genomics and Oncology. We're talking precision medicine now. So, historically, global medical research has had a massive blind spot. The vast majority of sequenced cancer genomes come from populations of European ancestry. Why is that a practical problem for localized care? Well, African genomes actually contain about 10% more unique genetic variations. If we're not in the data, the treatments just won't work as well. That is exactly why local innovators like Yamachi Biotech are stepping up to build the world's most diverse cancer biodatabases. By capturing this genetic diversity, they're breaking down historical biases to create truly equitable, inclusive precision oncology. And catching these unique markers early is exactly what's going to improve cancer survival rates across our diverse populations. But here's the catch. Human genomes are huge. Each one has about 3 billion base pairs. Processing all that data requires serious computational muscle. To pull it off, researchers use something called sparse optimization. Think of computational techniques like lasso regression or elastic net as ultra-smart high-tech filters. They automatically strip away all the background genetic noise so researchers can isolate the exact critical biomarkers associated with diseases like breast cancer or malaria. For the public health students joining us on This Explainer, here is a really simple analogy to wrap your head around it. Imagine trying to find a few relevant pages in a library containing literally millions of books. That's genomic research without sparse optimization. You're just wandering aimlessly. But with it, boom, the system hands you the exact 3 pages you need to develop a targeted cancer immunotherapy. It's that precise.
And the data proves this is catching on fast. Between 2020 and 2024, there has been a rapid, rising adoption of these optimization techniques within local biomedical research in Ghana. Institutions like the West African Center for Cell Biology of Infectious Pathogens are heavily utilizing tools like lasso regression, PCA, and elastic net. They're managing incredibly complex, high-dimensional genomic data and achieving high classification accuracy, even when dealing with limited computational infrastructure.
Section 4. Frameworks for Responsible AI. Because innovation is great, but governance is absolutely crucial. You see, when researchers ran field surveys across low-resource settings, specifically in Nepal and Ghana, the results were pretty eye-opening. A whopping 85% of respondents flagged ethical oversight as their primary concern when it comes to bringing AI into healthcare. People have very real, very practical worries about data privacy, cybersecurity vulnerabilities, and whether their medical data will actually be protected by standardized laws. On top of that, the same study found that 72% of regional experts emphasize that localized government structures aren't just nice to have, they are essential for building patient trust. Let's be real, if we just import AI models trained exclusively on Western datasets, they are going to struggle in our local settings. That leads to skewed results and dangerous algorithmic bias. You can't just drop a model out of the sky. You have to govern it locally so it's actually safe and accurate for the people it serves. So to tackle this algorithmic bias head-on, researchers have drawn up a conceptual flow diagram for a responsible AI framework to help guide national policy. It systematically maps out everything from the initial literature review and gap analysis straight through to data collection and framework development. This isn't just theory, it's a practical blueprint for crafting policies that align perfectly with our local socioeconomic realities, rather than blindly copy-pasting international guidelines that don't fit our infrastructure. Practically speaking, how do we integrate this? The logistics are key. First, before any massive national rollout, we have to mandate small-scale, localized pilot studies. Then, we meticulously validate the AI against diverse, region-specific datasets to catch and correct demographic biases. And finally, we set up continuous, data-driven feedback loops. That way, the diagnostic accuracy keeps refining and improving over time. That is exactly how you prevent algorithmic drift and ensure patients stay safe. And finally, Section 5, building the tech workforce. Let's talk about how we make this sustainable. How do we make sure all this incredible innovation creates real economic benefits for our communities? We build our own capacity. We are actively training a localized African AI health workforce to manage these new technologies. For example, the Runamilla AI Institute is doing phenomenal work training local healthcare workers and scientists in advanced computing and AI. Meanwhile, Yamachi Biotech is offering amazing youth internships across bioinformatics, molecular biology, software engineering, and even finance. We are not just consumers of imported tech. We are building professional pathways for local youth to literally lead the global digital health revolution. So, I want to wrap up this explainer by throwing it back to you. As policymakers, you have a massive choice to make. Will we step up to implement these national regulatory frameworks and invest in our youth today? Or will we sit back and let historical biases dictate the future of our digital health? The technology is already here. The clinical evidence is undeniable. The workforce is ready. The next move is entirely yours.